County. So we're glad to be joined with these folks who will have, hopefully, answers to all your questions. And I'm certainly not going to say that I know more than these good people. That's why they're here. So again, thank you for being here. We all know, I'm sure you've been thoroughly saturated with the news over the last few days, and so it's not a big question that as to why we're here and why we're sharing this information. It's just our attempt to make sure that everyone, no matter how secluded, knows exactly what's going on, at least in Clay County. So the information we share with you here today, a lot of it is redundant, but you may hear something that you didn't know, which would validate your time watching the TV and these good folks from the various channels. We are in a very tough time right now, a time of uncertainty in our community, and our nation, and our world. But folks, keep in mind, we, at least I personally, and I'm sure everyone out there has faith. We have faith in the people. They're kind people, they're compassionate people, and they're resilient people, as well as those people in the loop all the way up to Washington, D.C. We're all this in together. We're part of a team to get through this. And as I mentioned earlier, faith is an integral part of this. And with faith comes certainty, not uncertainty, but certainty. And I can tell you this with all degree of certainty. When this is over with, our nation, our state, our community is going to come out the other side stronger than it was the day we went into it. So keep that in mind. That's the part of faith that no one can take from you, and that's the part of certainty that will keep us going through this. I'd just like to, we're going to have time for questions, and at this point in time, I would like to just turn this over to John Ward, our Director of Emergency Management. We'll get on into the weeds on a few more items that we need to share with you. So John, if you could come up, please.
Thank you, Chairman. I appreciate it. First off, I'd like to say the county expresses its condolences to the family of the gentleman that passed. The entire county is in mourning now because of this first incident here in Northeast Florida. One thing I do want to say is the unified command that we have here with our partner agencies has been working and planning together for weeks, if not months, looking forward or looking and planning towards this event that could potentially impact our community. We have some of the best partnerships with our health department and our law enforcement and our first response agencies that are here. So I want to ensure our Clay County residents that our team is working together to serve our citizens here in the county. One thing I want to discuss is we're hearing a lot of issues into our call center. For any of our folks that have questions or concerns they'd like to discuss with the leadership team here, our number is 877-252-9362. Again, that is 877-252-9362. And that is our call center that is open from 8 to 5, 7 days a week, with professionals that are here to answer questions and gather information so we can put that out. But the one thing we're hearing a lot of here within the county is the stores being low on food, low on products, those type things. One thing we want to ensure our residents is this is not a hurricane type event. We're not going to be without power. We're not going to have a long time to have to deal with this event. Don't surge buy. Buy your normal products and allow the system to restock accordingly. The commodities are out there, but we're seeing a lot of surge buying in this, which is what's causing a lot of the shelves to stay empty the way they are. Again, I just want to say for gathering information, we had a little bit of misinformation at the beginning of this when it impacted Clay County. Please only be gathering your sources from the CDC, the Florida Department of Health websites, or our emergency management social media pages. That's where all the official information is, so you can keep track of what's going on in your community as we work forward. And again, I'd like to say our partnerships are strong here. We're working to serve the community. And I'm now going to turn it over to Mrs. Heather Huffman, who's the director of the health department here in Clay County, and she actually has the lead in this event, and she's the person that we're supporting in the response to this. So,
Thank you, John. First of all, I wanted to give you an update of where we're at, and I think the first thing we want to do is really pray, and our thoughts and prayers go to the family of this involved with this gentleman yesterday in our county. So just to give you a latest on the data, is we still have 4 confirmed cases. One has unfortunately had a death related to that, so our case number has not risen. We're continuing to do those case investigation and those contact investigations with anybody that's a positive COVID-19 or any patients or residents that are considered as persons under investigation. We currently have 3 full-time epidemiologists on staff with Clay County and Florida Department of Health. We have paired them with an additional staff member in-house that has a master's in public health degree in addition, so they are 3 two-man teams working 10, 12-hour days to do case investigations, field calls from providers and hospitals and nursing homes and ALF so that they're providing the correct information. We are, again, providing the guidance that is based out there from the Florida Department of Health or the CDC. Those are the only reliable sources of information when we talk about healthcare guidance. We continue to work with our hospitals, nursing homes, ALFs. We are holding twice a week healthcare facility calls to push information to them and answer any questions, but they also know our numbers and they're able to call us at any time, day or night, with any questions. We are also today doing a call down with all of our nursing homes and ALFs so that we can actually have a one-on-one call with those facilities, talking about any needs that they may have, but also looking at any things that they have specific to their patients or their supply needs. And then ACA, I know, has been going out to these facilities and doing checks with them related to the guidance of no visitors and prohibiting visitors and screening staff. So at the end, I just want to also reiterate what the governor has said related to prevention messages, hand washing, 20 seconds or more, along with the use of hand sanitizers of 60% alcohol or more, and social distancing. It's imperative that if you don't need to be out in the community, you are not out in the community. It's basically basic needs at this point. What do you need from the grocery store? What do you need from a pharmacy? But you're not going out and having those social gatherings. It's less than 10 people. You shouldn't be having events at your home or dinner parties or anything like this. This is, to your home and out only to get your essential needs. And so with this point, I'm going to return it back to Mr. Hendry, and then we'll take any questions.
Thank you, Heather. What gives me great satisfaction to live in Florida is America is the greatest nation in the world. We have the finest doctors, we have the finest nurses, we have the finest scientists, the finest researchers, and based on what we have produced in our society, we will overcome this. We will win, and we will win big. I just want to say again, and it's already been mentioned, to the family of the gentleman who we lost due to this, our prayers, our hearts go out with you. I lost a family member a few years back, and I know how difficult it is to get through a situation like that. You'll get through it, trust me. You'll never get over it, but you'll get through it. And I'd just like to make sure that one person has not died in vain, and we do what we need to do. And if we use a little common sense, if we follow the directions of our medical community, there's one right there, we will get through this, and we will win. In any great trial and tribulation like this, you have to keep it in some historical perspective. As a student of history, the people in Northeast Florida have lost tens of thousands of its finest to the wars of our country. We've lost a handful. Does that make it easy? No. But this is not something that's greater than we. We are greater than it. And we will pull together to the degree that we make ourselves victorious and overcome this. And hopefully in a short while. I've been very impressed with what Washington's doing, with what our president's doing, and I think they're on top of it, and they're trying to push out the finest product available to us. So let's keep that in mind. It's not just Clay County, it's not just the state of Florida, but this is a national effort, and we're going to win. Trust me, we are going to win. So with that, I will turn it over to any questions that we may have for our fine staff. Yes, ma'am.
Mobile testing, where and how can people get tested? Are you setting up testing sites?
Good question, and we should have covered that early on. John, we have some kind of schedule on that?
So right now, currently, if you go in and see your local physician and they prescribe, they suggest that you need it after going through the workflow matrix, they will be sent to either LabCorp, Quest, or the health department labs to do that. The federal level are in the process of setting up 3 testing sites in the state of Florida. one in Tampa, one in Miami, and one in Jacksonville. They should be opening over the next few days, and those are regional testing sites manned by the federal government. So that'll be additional testing that will be put online.
Do you believe that you've had success tracking down the people who your positive patients have come in contact with?
So yeah, so Miss Heather's team with the Department of Health have been doing the contact tracing and working back through the people that have been in contact with those over the past 7 days, and her team's been exhaustively working that since last Thursday when we received our first case.
And getting those people tested as well, or how does that work?
So if they work through, you want to talk about that?
Yeah, just to reiterate about the testing sites, it's Orlando, Jacksonville, and Miami, just so that we have that correct information out for our citizens. So we do the contact tracing for them, and then we do interviews with them, and based on that information, we put them in risk categories according to the CDC, low risk, medium risk, or high risk. And then based on that, we always do self-isolation as a mandatory for 14 days. And then based on those and what category they would get in, if they're symptomatic, then of course testing would be appropriate. But asymptomatic, we are not testing asymptomatic individuals.
At what point, what's the line for low risk, medium risk, high risk when it comes to testing? I'm hearing that maybe testing isn't available for everybody who may think that they have it. Where are we at with low risk, medium risk, and high risk as it comes to fever, different symptoms? What are we looking at?
Every person that has been categorized and risk assessed according to our disease control staff that have been high risk and are symptomatic, we have tested those. No one has been turned away for those. Medium and high and low risk do not necessarily need testing. It depends on their exposure. Were they an exposure to an exposure to a positive? So every case is a little bit individualized. We are asking the providers in the community before they send anybody or a patient to call our disease control staff, those 3 epidemiologists, and do a triage with them that says what category does this patient fall in, so that we can get them to the appropriate place if they need to be tested or if they simply need to self-isolate, and what we're looking at in that situation.
I feel like with the high risk testing that we may only see the cases that are like that, where the numbers may be actually lower than what the community would see if we were able to test more people.
Again, the guidance from the CDC is we do not test asymptomatic individuals who have not been at any risk related to a positive COVID-19 case. So we do not have a infinite amount of resources, and so we're wanting to test those that are at the highest risk, and then do those contact tracing. You know, regardless if a positive or a negative, the main thing is that people will self-isolate and then control that risk and that exposure. So we wanted to let people to know that just going out and being around other people increases your risk, and the more you self-isolate, the less of a likelihood that you will have that exposure.
And can you just reiterate the 4 cases here? How many, if any, were travel related? Can you just reiterate that again?
We are still doing case investigation. Currently, the data that we have, none of them have travel history. But again, as we continue to move through that case investigation, we'll be able to provide more information. Just off of the first glance of what we have and the interviews that we've done with them, there is not a travel history, but we will continue to interview the context that they've also had.
Those at a higher risk, what are the symptoms they should watch out for?
So the symptoms have not changed. Again, it's fever, shortness of breath, and a dry cough. So it's, again, that cough that kind of comes from nowhere, and you don't really have a runny nose or a sore throat or any kind of post-nasal drip. It's that dry cough.
Heather, this may have been answered or asked, but do we currently have any plans to set up a drive-through testing? What's the status on that?
John, I'll let you answer.
So at this point, we are not. We're having discussions with some of our partners throughout the community to take a look that if the surge does increase within the county to set this up. But as of right now, we've not seen the need to set up a drive-through site beyond once that regional site gets set up with the capacity from the private vendors that are doing the testing at this time, sir. Anything else?
Any further questions, ladies and gentlemen? If not, I'll go ahead and close. Anything else? Okay, I'd just be remiss if I didn't call the attention to everyone concerned. You know, in any great endeavor, especially in a crisis, it never hurts to seek, or it is advisable to seek divine guidance and assistance in this matter. I would ask everyone out in TV land, if you have a relationship with the Lord, please pray. If you don't, find somebody to help, and just do your little part in making this a victory on our side over this dreadful disease. Our county manager, Howard, do you have any final comments, sir?
No, sir.
All right. Okay, with no further questions, then we're going to close this session, and folks, go forth and continue to do your good work. Thank you, and have a good day.